Hey there. Welcome to a new episode of the Community Show. On this week's show, we're going to be taking a little bit of a different path. We're bringing you an extended something to chat about. We will have 3 guests this week. Our first 2 guests will be Tina King and Janet Brennan with the New River Valley Agency on Aging. And we're going to be talking about aging for older people and what we can do as children to help them. And then finally, our last guest will be Teresa Sweeney with the Montgomery Regional Solid Waste Authority, or Mr. SWA. And we're going to be talking about recycling and how it helps our environment and how you can do that. So stay tuned and we'll be right back after this. Now for our first 2 guests for this week's Something to Chat About. Please join me in welcoming Tina King and Janet Brennan, who will be discussing how you can prolong your independence as an adult and how we as children can help prepare them for their independence and prolong that as well. Today we're here with Tina King and Janet Brennan, who are from the New River Valley Agency on Aging. So tell us a little bit, first off about you all. What do you all do at the NRV Agency on Aging?
Okay. Well, I'm the executive director of the New River Valley Agency on Aging, and of course work over with all the programs and work with a board to help set policies and procedures for the agency.
Cool.
And I have the opportunity to do what I call my heart's work. I serve as a long-term care ombudsman and elder abuse prevention specialist.
Okay.
And what I do is advocate for the rights of persons who are in long-term care facilities or who are receiving long-term care services and supports. And I also help to make sure that persons are treated with dignity and respect, and to make sure that they are living in an abuse-free community, home environment.
Okay.
So that's basically what I do.
That's great.
And a broader perspective in the community is just to raise the awareness of the needs of older adults and work with other partners to help meet those needs. And so we both are looking for opportunities to do that in our work.
Great. So tell me, what are some of the population trends in the New River Valley and Floyd County for people 60 and older?
Well, definitely the population is aging in the New River Valley as well as in Floyd County proper. In the New River Valley, there's around 32,000 people age 60 and better.
Okay.
This represents about 19% of the overall population. In Floyd County, 25% of a population of about 44,000, give or take, are 60 and older. So 1 in 4 individuals in Floyd County is age 60 or above.
That's crazy to think about. So, how do these trends compare to the rest of Virginia and the United States?
Okay. The trend is national and statewide. Nationally, there I guess about 18% of the total population is age 60 and plus, with projections growing to about 25% of the population by 2030.
Okay.
And then in Virginia, I think, let's see, I don't have a 60 plus population for just Virginia, but obviously it's growing. I know that currently there's about 800,000 people 60 and 65 and over, and that number will reach to 1.8 million by 2030.
Wow. So how challenging is it for someone who is older to live on their own?
Well, I guess when you're asking that question, you're asking for many different aspects.
Mm-hmm.
Some of the things that we see is that we want to help persons focus on the positive aspects of aging. More often than not, we hear about the negative aspects, but we want to look at the positive things too. one of the things we look at when they're living independently is about the accessibility within their home, within their community, accessibility to support services that may or may not be available in their immediate community. We're also looking at how can we help them sustain the quality of life that they've always come to know or that they want to have as they continue to age. Getting older or aging doesn't necessarily mean having deficits. It means some positive aspects of that. When we look at one of a more current study, the 2010 AARP study on quality of life and living independently, we look at those challenges of mobility, challenges of transportation, accessibility and affordability of healthcare services to meet those needs as they begin to age.
Okay. You have anything to add?
I was just going to say, I think it's important to note that only about 5% of the older adult population reside in facilities.
Okay.
So about 95% are living at home with varying degrees of service needs and support needs. Many of them are very independent. But for those needs, sometimes they can happen so gradually that they're in a dire situation before they and or their caregiver realizes it. For others, it can be a very catastrophic event that can bring them to having those challenges of living alone. So I would also echo what Janet said in terms of, especially in a rural area such as Floyd, often having transportation needs met to get where they need to be, having those supportive services that are maybe much more available in more densely populated areas. And then mostly there's older housing stock that need modifications and weatherizations and things like that in rural areas.
Okay. Now, do you have any recommendations on how to prepare to be ready?
Well, I think that although it's not a human tendency to assess what our needs could be before we get there, I would recommend that people step back and really think about what it is that they might need if they truly want to age in place, if they want to stay in their home and in their community. What kinds of things could they do on a very simple and inexpensive basis to adapt their home environment? What can they do to help navigate in their physical environment to reduce the risk of falls and to make their lives more comfortable? Looking at exiting and entering their home. Is that going to be a barrier? What can they do to adapt that? What preventive measures can they take with their health and their daily activities that would help them going forward? And I think it's important if they can educate themselves on what's already available in their community so that if and when they need it, they'll know where to go for it.
Okay.
And we also know the importance of social relationships or those connections within the community itself, because as persons begin to age, they may become more socially isolated, which places them at a risk for other things, be more vulnerable with that social isolation. So those relationships or those connections, we tend as we get older to sort of have our own personalities that we see our lives as our lives, and being as connected with the community still needs to be important. Even if someone were confined to their home, those social relationships are extremely important. So it's important to keep those in preparation for as one gets older.
Okay. And so what are some things that we can do as children to prepare ourselves to be ready to take care of our parents?
Well, I think we need to have conversations early and often with our parents, trying to learn from them what their preferences are and what can realistically be done to help support them in those preferences, and remembering that we need to plan together to be more of a care partner, so to speak, and help respect their right to self-determination and as much as possible, understanding that their needs may change greatly over time. There again, just as mentioning for the preparing ourselves to age in place, being aware of resources and supports that are in the community, perhaps even before they're needed. And one thing that I think I failed to mention in the last question you posed is trying to know whether or not perhaps long-term care insurance is right or feasible for
Right.
you, or if financial assistance might be needed for supportive services, being willing to look into what kind of public assistance might be available to
Okay.
support you and your needs.
Okay.
So I think that's important for caregivers to know about.
Absolutely.
And to take advantage of programs themselves.
The
for
other thing,
caregivers.
and as an ombudsman, and when I encounter elder abuse situations, one of the things that is extremely important is that persons start talking about what we call forms of adult protections, documents that would be important so that the elders can express their wishes and their preferences. For example, with an advanced medical directive, that it's a document that allows the person to put in writing what they want and what they do not want. When those persons reach that level of incapacity, they're not able to express those wishes.
Right.
So we as adult children can help our parents look at those things, and as Tina had said, having those conversations about what do you want?
Right.
Let's talk about it. Let's put it in writing if we can, and put those things in place before they reach the point they're not able to have those conversations.
So talking and being comfortable is definitely the high points of what we can do as or making our parents feel comfortable as children of aging parents, correct?
Correct, and it can be difficult. It can be a difficult conversation to have in some families, obviously, depending on the dynamics. And it's not comfortable. I don't want to say to have a role reversal because it's really not. But yet, in some aspects, it's similar to a role reversal and being there and being supportive for your parents as they've been for you
Right.
growing up. And it's hard for some people to have those conversations, but learning to approach them and learning how to make it more of a comfortable topic so that when the need is there, it's easier to work through
Right.
it.
It is. It's difficult to have a conversation with someone about end-of-life care, for example, when they haven't reached that point. But we or you as a young adult, I as one who's a little bit older, we have to really look within ourselves about our own comfort level about having that conversation.
Okay.
And once we prepare ourselves and we're comfortable with having those types of conversation, it becomes a little bit easier to have it with someone else, to have that conversation with them too.
Right. And now we've talked a lot about how to be prepared. Tell me, are there any economic implications that are related to aging for the individual and for the public?
Many,
Okay.
on a lot of different levels. And I don't know if you would divide them into positive economic aspects or negative, but really I think it's fair to first focus on the positive aspects of aging economically. And, some people may not realize it, but the value that older adults bring to a community, that can range from the value of their volunteer work to the stable tax base, because most older adults are homeowners,
Right.
the highest majority. And so they bring a stable tax base, and also as consumers. They have a relatively high rate of ownership, as I said, and certainly give back to their communities through their taxes. Also, through the volunteer work, in a recent study done by the Retired and Senior Volunteer Program, don't know if you're familiar with that, but they're usually in each community. In the Floyd community, in the past year, 2013, the volunteers that were involved, older volunteers in that program, donated about 13,000 hours of volunteer services to nonprofits and governments at a value of about $310,000.
Wow.
So that's pretty phenomenal, I think. Also, older workers bring a tremendous amount of skill, those who are still able to work,
Right.
and many are, and many plan to work past retirement, and they bring strong work ethics into the communities. But if you want to talk about maybe the health-related cost in terms of aging and what that means, older adults are more prone to falls,
Right.
and debilitating repercussions from that. And nationally, about $16 to $19 billion cost is incurred from falls.
Wow.
If you want to break that down to an individual cost, it's about $17,500 per person for that cost. The average cost for out-of-pocket health care for an individual with Medicare in the last 5 years of life is about $39,000. In terms of cost of supportive services and facility-based services, do you want to say something about that, Jenny?
Well, we brought with us, a little cheat sheet.
Okay.
I actually just found the Genworth study on long-term care costs. It was some of the most recent findings. We're seeing that home health care aides, the costs that a private agency can get for providing an aid, that's been relatively flat. It hasn't really gone up a lot. Nationally, it's about $19 per hour. So we kind of see that being really, really constant. Where we see the growth, and looking at the Genworth study, 2013, some of the most growth that they're projecting is actually going to be with assisted living, nursing home, and some of the nursing home private care. So we're seeing the growth there in the costs. We see it pretty steady with the community-based care and the community-based supports and services. The growth seems to be rather steady.
Okay.
Not a significant increase. So that, if you're looking at the financial implications for our aging population and those with disabilities, we're seeing very cost effectively that if the services and supports are available, then it's more cost effective to keep someone in their home, and not to mention the value that it gives to the families and to their lives. Okay. So these costs may seem somewhat alarming. We look at nursing home care, and people sort of cringe when I say, here's what the cost of nursing home care potentially could be. We see nursing home care at about $6,500 a month.
Wow.
Private out-of-pocket.
Private out-of-pocket cost. The per diem rate, if we're looking at Medicaid coverage, the per diem rate can be variable depending on the amount and level of care that a nursing home provides, but usually it's about $160, $170 in that range that Medicaid reimburses per day. Assisted living level of care, in the New River Valley, we see the lowest I see is about $2,500 to as much. One couple paid $12,000 a month for that care. Wow. Here in Floyd County, we do have a nursing home here that does provide long-term care, rehabilitation, skilled nursing care, and also dementia care, or what we call cognitively impaired, those who have cognitive impairments. The unfortunate thing is there's no assisted living here. So there's no in-between from community-based home living to the nursing home care. That's that massive leap. So, but some other pretty creative things that are occurring. Private care homes provide that long-term care. So the costs can be here or it can be way up here, depending on the care needs.
Yeah, and I think it's important to note, too, that as you were talking about the private out-of-pocket cost, that for people who qualify financially, there are some public benefits through Medicaid that can help them stay in their home through waiver programs, the elderly and disabled consumer directed. And then also there are some other services that can help subsidize and help support financially to provide services so the total cost would not be out of pocket.
Okay. And now tell me, here at Citizens we have a medical alert. Does that, is that something that helps older people as well as home security even?
I can certainly speak for the medical alert.
Okay.
We have had many clients that we've served, and just knowing that they have that connection to immediate help if they have a fall or some kind of catastrophic thing happen, and helping them stay connected, because we've already mentioned about social isolation at times, and the things that can happen when a person doesn't have access to care if they're having an emergency. So I know from a professional standpoint that they are very helpful for many people who are unable to, or who may be experiencing some different levels of care need.
Okay.
And under the Medicaid program, we're looking at the community-based waiver program. That actually is a program under long-term care Medicaid, and the persons opt to live in their home and live in the community versus going to institutional care, nursing home care. And the wonderful thing about the Medicaid program, if you're talking about the medical alert, if persons need supervision and they can't be left alone, or they prefer to use that, Medicaid will actually cover the cost of a medical alert for certain individuals under long-term care Medicaid services.
Okay, that's great. So tell me, what services do you all offer at the NRV Agency on Aging?
Well, we offer a wide variety of services. Janet, do you want to, first of all, I think maybe I could just give a broad overview about an area agency on aging. We're one of 25 in the state of Virginia, and we cover the 4th Planning District, which of course is the county of Floyd, Giles, Pulaski, and Montgomery, and the city of Bradford. In your other coverage areas, there's a couple of other AAAs that if you want that information, we can give that later. But our mission is to help support and enhance the lives of older folks and adults with disabilities and their caregivers, to help them live independently and as safely as possible in the environment they choose, mostly at home. And we do that through a variety of services that Janet will talk about in a minute, and through advocacy and information and education. And we do this in partnership with a lot of other agencies too.
Agencies and other entities.
Other entities and organizations and individuals.
We've created such a broad aging network that if persons were to call our agency and we don't have the information, the resources, we actually have connections with so many others that we can say, try this. We can divide our services into actually 3 categories. Our support services, which include those direct services to the aging population and to the caregivers, also with education and resources like information that we can provide to them, and then also with what we call advocacy and planning services. And under each one of those categories are our different programs. When we look at the support services, we're talking about our congregate meals, which is the Friendship Cafe, our homebound meals. Some people refer to them as Meals on Wheels. That's our national program for homebound meals. Also with our homemaker support services and our respite care services to provide supports to the older adults and to their caregivers so they can stay at home. Also, medical transportation if they need to get to a doctor. And shopping. And then we have one unique program under our support services. It's called Care Coordination. And basically it's case management services to work with the older adult and work with the caregivers. Together a comprehensive set of services to best meet their needs. So that's sort of like it in a nutshell. Under our education resources, and I often joke about it, that I say to persons, I've given you so much more than you had expected. I haven't given too much, but we take it very seriously that when we have those conversations with the persons on the phone, we want to make sure that we've provided enough support and information and resources to help them make the choices that they need to or that they want to, and so they can be better informed. So that's through the Speakers Bureau, through our Retired and Senior Volunteer Program, through our annual Caregiver Conference that we have every year when we bring in one of our nation's foremost experts on Alzheimer's and dementia care. And as I mentioned, when persons call into our agency, they will be in touch with any one of us, and we'll talk about what the information is, what resources or what referrals we can help them with. So that's that part of the education. And then through our advocacy and planning services, that's where I am, with the elder abuse prevention, with the long-term care ombudsman program, with our legal assistance services, with our Virginia Insurance Counseling and Assistance Program. Helps with the Medicare, looking at Medicare benefits, looking at Medicare programs, and helping persons navigate that system and looking at all those options that could be there. And then our care transitions program with one of the local hospitals, and Tina certainly has more information about that, but and under each one of those programs, is a multitude of supports that we can provide.
Okay.
But more importantly, it's really about the expertise, the knowledge, the skills that our staff have to be able to have those conversations with persons with whom we come in contact. And I say to Tina that she has assembled some of the finest aging and disability specialists within those small walls of our office.
I think Janet is one. But also, while our administrative office is in Pulaski, because that's where we started almost 40 years ago, we have had a presence in Floyd the entire time and are very happy to say within the past year, through partnering with other entities, we have a satellite office, intermittent, small though it may be, the second and fourth Friday of every month, located at Skyline Health and Rehab.
Okay.
It's a great partnership from 8 to 4 o'clock.
Right.
People can walk in, stop in, make appointments. We also, the library has offered us a place to have monthly presentations, which we do, on topics pertaining to aging and caregiving.
That's great. So how do people get in contact with you?
Well, there are phone numbers and email and walk-in. So in regard to our phone numbers, would you like me just to verbally get that? Okay. We do have a toll-free number for folks living in Floyd County.
Okay.
If it's long distance, it's 1-866-260-4417.
Okay.
And we can be contacted by email if someone uses the computer. And that is NRV, as in New River Valley, AOA, as in Agency on Aging, at nrvaoa.org.
Okay.
And then, as I said, our administrative office, if you want to come to Pulaski, we are located in Pulaski at 141 East Main Street.
Okay.
But certainly available in Floyd the second and fourth Friday at Skyline Health and Rehab.
Okay. Well, that is all the time for today. I appreciate you both coming on the show and talking with us.
Thank you.
And now for our second guest, please join me in talking trash with Teresa Sweeney. Is Teresa Sweeney with the Montgomery Regional Solid Waste Authority, and we're going to be talking about what you see on the table, recycling. So it's great to have you here.
Thank you. Good to be here.
So tell me, what do you do at the Montgomery Regional Solid Waste Authority, and how did you get involved?
My primary focus is on awareness, environmental issues, things like that, educating the public. I work a lot in the school system in Montgomery County, and I do have some schools that from Floyd County that bring their students over for tours and programs at the recycling processing facility.
Okay.
And I got involved because I was unemployed, and they had a job opening. It was a new position for an environmental educator. And so I applied for that position, and I've been there for over 17 years.
Wow. That's awesome. So what exactly does the Montgomery Regional Solid Waste Authority, the mouthful, do?
Well, we call ourselves Mrs. WA, the MRSWA, so we abbreviate that, or Mr. SWA, whichever you prefer. Okay. But the reason that we were formed is there were regulations that were being passed down from the state. Each locality had a certain percentage of recycling that needed to happen, and there were some other regulations that were putting some pressure financially and just, operations-wise on local governments to try to meet those standards and meet those regulatory requirements. So the authority was formed so that collectively those things could be accomplished. And Montgomery County chose to use Montgomery County, the towns of Christiansburg, Blacksburg, and Virginia Tech. So they are the members that form the authority. And then, like I said, they collectively meet those regulations and requirements. Okay. But we also serve the region. So Floyd County, we could take their recycling, or we could take Giles County, and we do. We take Giles, Radford, Pulaski, Dublin, and we could take Salem, Roanoke. So it's a regional approach. We're there to process materials.
Right. Okay. So tell me, why should people recycle?
Well, I think that it is one of those things that's very easy to do, but it is conserving resources. And we hear people talk about preserving our earth and things like that. And I think there are just some simple things that we can do just to be more responsible citizens. Right. For instance, recycling cardboard, recycling newspapers, recycling your aluminum cans, things like that. something that's very easy to do, and there are opportunities for you to do that all over this region.
Okay.
But those are actually made into new products, so you are conserving those resources by reusing them. And a couple of examples that I have here, I have a piece of tile here that's made out of recycled glass.
Okay, wow.
And you can actually see the different colors of glass that have been crushed and used in making that tile. Another real unique item is plastic soda bottles that can be made into fiber.
Wow.
This fiber is then made into things like carpeting.
Okay.
Even things like your North Face jackets are using reclaimed soda bottles
Okay.
and #1 plastics that can be made into the fiber
Wow.
also. This tennis shoe, there's a little tag on there that says that it was made out of soda bottles, a little
Okay.
bottle tag. But these are things that some of them you can buy locally at your home improvement store, or the tennis shoes can be purchased at local department stores and things like that. So they're out there, it's just you have to look for them
Right.
and read the labels.
Okay. So, what is the value of recycling to our environment?
Well, as I mentioned, conserving resources. It takes a lot less energy if we recycle something. One example of that is an aluminum can. Aluminum can be recycled an infinite amount of time, or number of times. So we can recycle that aluminum can, and within 60 days, that can is back on the store shelves and can be recycled then again. We
Wow.
call that closed loop recycling when it is a can and then it becomes a can again. But those can also be made into automobile parts, and we take things like siding and gutters and things like that, and we recycle those. But aluminum cans are one of those things that many, many people recycle, and they can also reap the benefits by getting some money back for recycling those items. But whenever we can save the energy and the resources by recycling, I think it's a responsible thing for us to do as individuals.
Right. All right, so tell me, what items can be recycled?
Well, at Montgomery Regional Solid Waste Authority, we have a dual stream process. So we have papers that you can bring in and commingled containers.
Okay.
And what's included in papers, you might have your egg cartons and food container boxes, your regular recycled or paper that can be recycled, whether it be photocopied paper, different colors of paper. So all of those go into one grouping. And
Okay.
then we have things like plastic bottles, aluminum cans, steel cans, things like that. So
Okay.
those would go in one category.
Okay, and I see a cell phone here. Can that be recycled?
It can be recycled. And we take these in through our e-waste program, which is electronic waste program. We also
Okay.
take bulbs and batteries.
Okay.
But these are very easy to recycle, and a lot of the local schools use a program called Funding Factory, and they have boxes that are sent to them. They fill the boxes up
Okay.
with items like this, printer cartridges, things like that. Then they send them back to Funding Factory. Funding Factory will then give them a check for a certain amount of money. So it's a good fundraiser for some of the PTA programs and things like that.
Okay, and how do people bring items to you? Do they bring them in bags, or how's that work?
We get them always, but bags, plastic totes,
Okay.
cardboard boxes. It's however you want to collect that at your home.
Okay.
So these are nice because we have these for sale at our place that we sell. A lot of people like them because they're small and they stack.
Okay.
So
Wow.
you can put your papers in here and your containers in the other one,
That's awesome.
and it's just a nice little setup. But you can buy those at a local department store, home improvement store,
Okay.
things like that. Anything that you want to have in your home to store it in.
And where are you all located that people could bring these at?
We are located at 555 Authority Drive. We're
Okay.
kind of over next to the Frog Pond in Christiansburg. A lot of people know where that is,
Right.
so we're right there near that.
Okay. And do you all have a website that people can get more information on?
We do. It's mrswa.com.
Okay, so MrSwa.com or Mrs.
Or
Wa.
Mrs. Wa.
So go to mrswa.com and check out that. And that is all the time we have for today, but I appreciate you coming on.
Thank you.